Hi, I'm Julia Michelin, and today we're going to talk about artificial intelligence in dentistry. And I have a super special guest, Dr. Fahad Umer. He's Associate Professor of Aga Khan University in Pakistan and the founder of Medentec. Fahad, thank you so much for having this time for the call. And I'm really excited to hear about your background and how did you end up doing a lot of searches in dentistry, in AI in dentistry.
Hi, Julia. Thank you very much for having me today. And I'm also very excited to talk about AI, especially when it comes to AI and dentistry. I'm very keen to talk about it. Um, when we talk about my background in AI, was never formally trained in artificial intelligence or computer sciences for that matter. This was actually the time of COVID, and we had some free time available to us. Actually, I'm really a clinician dentist, and during my time there, or during my off time from clinic service during COVID, I was reading a little bit of literature, and then I came across a few articles, especially in pathology and AI, and I thought this would maybe actually very relevant to dentistry. And me being an endodontist, I was keen if there are any endodontic applications with relation to AI and endodontics. So that led me to do some background work, wanted to do a narrative review that actually then turned out to be a scoping review, which we were able to publish in one of the top tier endodontic journals, Journal of Endodontics. Yeah. So that's how
That's
it
cool.
all began.
That's really nice. So basically, like after pandemics or during the pandemics, like 2019 around something like this, you realize how important and how big this is gonna be, especially in dentistry, right? Because if we see AI in like the timeline of AI, it seems like 1950, but now we are seeing a lot in dentistry, right? So now we are seeing.
Exactly. Actually, when we started off, it was more about computer vision and convolutional neural networks. Um, OpenAI or ChatGPT didn't really become mainstream by November 2022. So, at the start, we were researching more about computer vision and how we can utilize it in diagnostics in dentistry.
That's amazing. And that's a big opportunity in dentistry, right? Especially in making dentistry accessible and how to improve the life, even the life of the dentist and the life and the quality of the treatment for the patient, right? So what are the focus that you like most in like AI in dentistry in general, like focus more on
So when
patient
I
care?
started doing research around AI, like I said, it was initially research with systematic reviews and scoping reviews, but we wanted to do something a little bit more meaningful, something more tangible. So initially we started working with radiographs, and we were able to develop models of OPG in which we were able to automate the OPG based diagnostics. But a lot of other people were doing that. Something that really hit home for me personally was that I come from a low income country. I wanted to make an impact in areas which are rural communities, and therefore I thought maybe the learnings that I have, I can leverage them for the betterment of the access to healthcare for rural communities, and that's how I began work on dental caries and using clinical pictures to diagnose diseases.
Okay, that's really interesting. So first, it was focused more on OPG. So we saw like companies like Overjet, and even like we have some around the world doing this, that they did this, and it's still kind of like one of the first of using AI in dentistry. You see like things align and with Invisalign and everything. But you said about that where are you from and about your country. So how is dentistry in Pakistan? How, if you can have like a overview.
So I've been, Julia, practicing dentistry for almost 20 years, and I've seen the evolution that is happening. I've also, just for context purposes, been trained in the US, University of Pennsylvania, in microsurgical endodontics. So I've seen how dentistry works in the US. And to make that relationship, I think dentistry is coming up with the global community, that the digitization of the human age and the internet coming in. Things are actually moving at a faster pace as opposed to before. So we have everything that you can think of, digital dentistry, as well as like we're talking about AI in dentistry. Actually, we also from Pakistan making cutting edge solution based out of AI in dentistry.
Yeah, 100%. I think like Pakistan is a great country for technology, right? Like for innovation and technology. I heard a lot of innovations coming from
Yeah,
Pakistan.
there's a lot of talent,
Yeah.
especially when it comes to computer savviness. We have people who get trained in Pakistan at different kind of universities, and they go in the US, especially California, etc., and San Francisco, and they've worked with big companies like Microsoft, Google, as well as OpenAI.
Yeah, okay, got it. And in terms of healthcare in Pakistan, do you feel like that the dentistry or the dentists are more focused in like the big centers and the remote areas in Pakistan suffers from oral disease, and do you think this
Actually, a great,
inequality?
and I think it's in Pakistan, much like any other country, it's there in the US too. The big cities they get the better dentists, and it's the rural communities which at times suffer because they have this difficulty of access to care, as well as resource constraints of traveling to bigger cities. So it's there. I've seen it throughout the world, but obviously it's more protracted in our parts of the world where access to care is slightly more difficult. So yes, definitely, it's an issue, and especially because dentistry generally is a fee for service model. So whenever somebody requires some kind of a dental care, they need to reach out to a dentist and also pay for services that they are acquiring.
Okay, fair enough. Yeah, we see as like as a word problem, right? General word problem. And talking a little bit about Luma Brush products. So basically, Luma Brush, as you know, that we have the electric toothbrush with the intraoral camera. So with this intraoral camera, we can see what is happening inside the mouth, and then we can bring technology to remote areas, right? That's the main goal. And we are using deep learning image recognition on it. Do you wanna can you talk a little bit more about it and the process and how it works to train the training and the process?
Julia, first of all, I would like to say that Luma Brush is such a genius solution. We've been working with AI and we've been utilizing photographs to detect caries. But Luma Brush, what it does, the value it brings is that every day when the patient will brush their mouth, they can take pictures. And we know that caries is a slowly progressing disease. And if they're able to take this picture and they can see for themselves that if there's some kind of disease going on in their mouth, they are more likely to reach out to a dentist or reach out for care provision. Because we all know this, and you as a dentist also know this, when diseases start in the oral cavity, they usually don't give a lot of symptoms. And if we want to give some kind of a preventive care, or if we want to do an early intervention, we want to catch these diseases early. And the barrier to care is actually the access, especially for people who are living in far-flung areas or rural communities. So Luma Brush actually breaks that barrier. So I would like to congratulate you on that one. Absolute genius. And you know, marrying deep learning, computer vision, along with the Luma Brush technology, I think is going to be groundbreaking in terms of oral healthcare. We all know this, you as dentists, and we already spoken about it, that oral healthcare is broken, fee for service models are broken. We want to focus on preventive cares, or at least catch disease at an early stage so that the cost of treatment goes down and the quality of treatment goes up. So I think Luma Brush has a great role to play. This, along with the use of AI, will benefit populations and will actually help WHO and FDI achieve their goals of universal health coverage as well as universal oral health coverage.
Yeah, thank you so much. It's an honor to have you being part of Luma Brush as well. And we believe that when we use technology, and especially right now, that the technology is evolving really fast, and we can see the usage of technology. We need to bring this to dentistry. We need to bring this to make dentistry more accessible and to give the care, right? So this is not just giving the care, but you are preventing and you are bringing education to like everywhere. So that's the main point.
And I think it's also empowering the user who's using the Luma brush. When they are actually looking at the image in their mouth, enabled by the AI diagnosis, they will be more keen to get care. Their acceptance of treatment and treatment plans will be better. So I think it's a very useful technology, and I'm so excited for this to develop further.
Yeah, we are really excited. And let's talk about the image recognition and the deep learning capability a little bit, and how's like the process and what we need to do to improve even more the like our AI model.
Julia, that's a great question again. All AI models are data intensive. We know that ChatGPT has been trained on internet. So internet is like a whole lot of data. Likewise, when we're training these diagnostic models, it also requires a lot of data. It's data intensive. And it's not just providing it a lot of data, but we also want to make sure that we provide it with quality data. And this is where, it is very, very important that healthcare professionals come together and sit and, make these diagnoses on the healthcare data that they are utilizing, leveraging AI to make those diagnostics. So yes, these are data intensive things. And of course, technology is also ever developing. So newer AI models are coming up. We are getting foundational models which are able to generalize on newer tasks and newer diseases based on the previous learnings.
Amazing. And how do you see technology? How do you see the future of dentistry? Like, how do you see dentistry in like 5 to 10 years?
I think with the advent of AI, people are going to change. Their care-seeking behavior is going to change. Their acceptance of AI is going to change. With ChatGPT, we now know that people are reaching out to AI asking for medical and healthcare advice. Likewise, patient would want to get their dental checkup done at the convenience of their own home. So
Yep.
I think AI, as well as these kinds of technologies like the Luma brush, have a role to play. And the people who will take the initial steps or the are the torchbearers for this new development will be the one who will be successful. Our population is changing. Gen Zs are coming in, and now Gen Alpha is going to come in. They are more digital savvy, and like I said, their expectations in terms of care is going to improve and change. And I think this is all for the better.
Exactly. That's a great view to bring dentists more as like a preventive and in the education instead of the treating the disease that is already there, right? So we'd say a lot about prevention in the next years and using the technology and of course using AI as well.
Definitely agree 100%, Julia.
That's great. So today, what the main uses of AI in dentistry that I have been seeing, it's the X-ray diagnosis, the AI assistant that can transcribe the consultations, and intraoral cameras, so AI image recognition analysis in intraoral cameras. And what else? Like management in terms of how to like schedule consultations or even manage the dental clinics itself. Did you see something else is coming up?
So,
Insurance?
like you already mentioned, that the agents are already there. The agentic AI is going to help not just the clinicians, but also the care seekers. And so lots of new interesting stuff is coming up. It's an ever developing field. I think the sky is the limit as far as this field development is concerned. We also going to see not just artificial intelligence, but also spatial intelligence coming in, which means that we'll see more robots, could be more uh, spatially aware in terms of they're helping with the care of the patients, because we all know that dentistry requires some kind of an intervention. So I feel that the quality of intervention as well as the efficiency of intervention will improve with these robots, which are spatially aware, augmented by artificial intelligence coming in, and they are not very far away.
Cool. And you said that's robotics as well. So that's another really interesting part about that. You can use AI to automatize all the like some procedures that it's can be automatized in dentistry, right? So that's huge. So taking back in like 10 years, how do you see dentistry? How do you see like a dental clinic running in 10 years?
That's a great question. I think about it sometimes, and I think a dental clinic would evolve with all these digital interventions that are coming in, and the job of a dentist would change in terms of for example, for diagnostics, they won't have to take all the steps into coming into making a diagnosis, but they'd be ratifying the diagnosis, helping the AI and making sure the diagnosis made by the AI is appropriate. Likewise, with these robots coming in, the efficiency of service and the quality of service definitely going to improve in those dental clinics. And therefore, when this happens, and when efficiency improves, the cost of care also goes down. And
Yeah.
this is something that I'm hoping to see. And maybe also mobile dental care is going to become more prevalent, because you may not need a whole bunch of equipments and a dental office. You carry your office with you with the robots as well as the AI helping you.
Amazing. One thing that I really want to ask you is about the search in AI in endodontics. So can you talk a little bit more about like how you use AI in endodontics specific?
So in endodontics, there are a whole bunch of use cases, especially in radiology, in which there are certain difficult diagnoses that you want to make. Julia, you are aware when there is a root fracture, sometimes it doesn't really turn up on an X-ray, and it's human imperceptible. With AI, we are able to diagnose those things. Likewise, when we are doing endodontic therapy, a length control during root canal treatment is very, very important. And these AI-based models will tell you pre-op what the length, most appropriate length would be. So optimizing outcomes in way as well. So a lot of diagnostic use cases, like a lot of prognostic use cases too. You can look at disease, you can look at progression of disease and remission of disease on serial radiographs.
Amazing. So basically, it's like analyze X-rays, not OPG, but more specifically,
And those.
or OPG as well.
And CBCTs, of course.
Okay.
There's a lot of work being done around CBCTs and automating CBCT outcomes. Specialized AI, known as UNETs or UNET++, are being utilized to make diagnosis on CBCT scans too.
Amazing. It's really interesting because I think endodontics is, if dentistry we work with some limitations of what we can see, endodontics is a plus. It's like
Yeah.
it's always like you need to use your sense, or you need to use, like the feeling, and of course we need to like based on the cases and the it's not that easy to
With
some
time, we have to
practice.
develop that third eye.
Yeah,
Comes with
exactly.
experience. And I think that learning curve may be fast tracked for the junior dentist. And therefore, I feel like, with the AI coming in, the work of a dentist may become augmented or enabled with the AI. So a lot of times, Julia, this also comes up when I'm lecturing or talking about AI with junior dentists talking about, will AI replace us? And I feel like, no, actually, it will enhance our job. And it will actually make our job more easier, but the utility of dentists will always remain. We
Exactly.
educate ourselves. The teachers of the future will be different. The clinicians of the future will be different, and there'll be newer jobs coming up our way. So we need AI
Exactly.
ethicists. We need AI implementation scientists as well as deployment scientists. So newer jobs are going to come in actually.
Exactly, amazing. So yeah, we talk about a lot about like some jobs that's gonna be replaced by AI, and so every job that can be automatized can suffer from automatization, can be kind of replaced by AI. But I think in dentistry it's really important to talk about it, and I love even to go to universities to talk about this with the students because they are must normally much more mobile. They were born with the phone and with the technology, so for them they like to talk about it and they get used to really quick, so I really like to see this, and they got really excited to talk about as well.
The younger generation is very, very smart. They know that AI is here, and they also know that they're going to use it as a friend and not as a foe. So as soon as
Exactly.
we embrace it, I think our value that we hope to drive from AI will actually improve. And an analogy that I usually like to give during lectures is the automotive industry when that came in. Before, everyone was associated with the horse industry, right? So they said, oh, with the automobiles coming up, it's going to take away all the jobs that are associated with the horse industry. But actually, there was a job enhancement with the automotive plants coming up. People actually, their quality of life improved because their jobs description changed, which were much more higher paying. So likewise, I think this impact is going to happen same with AI. Some people also say that the impact of AI will be same as electricity's impact has been in the 1900s.
Yeah, so it's for sure a really exciting moment, and we need, and we should, and we need to talk about this in dentistry to bring this technology and to bring this what is possible, what is already there, the technology that is already there in so many other disciplines, so many other areas, and we need to bring this to dentistry as well. So it's a pleasure to talk about this with you. I really
Likewise,
appreciate
likewise.
it.
And I feel like you guys are doing a great job realizing that dream.
Thank you. It's really nice to have you there as well, and being part of it. And appreciate for the talk today. I'm sorry for my internet.
Thank you,
Got
Julia.
some,
It was wonderful
yeah.
talking to you as always. You've been a great host.